someone has problem on the knee, you will see this. It's me here. So if I want to check the reactus femoris, now they check the outside, 2 toes in, to check here, to bring this to here. No problem. Some people here cannot go. When you push the heel forward, is the stretch of the reactus femoris. Yeah? So if someone has problem on the knee, and you see, I cannot go, I want to walk more here. If I see the toes doesn't go down, I want to walk more here. If I see the leg more here, and I go here and it starts to be also coming up, I need to walk more here. So now we're going to do all. But when you give the treatment, you can decide where you want to stay longer and where you want to stay less. So you can do the energy line, a little rocking, so you did everything, and then you choose 1 or 2 techniques to the places that you need. The leg, and now I go to the middle here. I put slightly open, and I block and put more the soft part into the second line, more close. So you need to find it. Everyone a little bit different. I want it a little bit more open and a little bit, you lock, you create your fixed point. This is my fixed point. I go into the bone until I feel the bone. I have the bone now. I want to lock the way you want, how you like, but I have stability. I move and I just bring the structure to the fixed point. I push, I have a little bit leverage. I go close, lock. You want to be like this, you want to be like that, all okay. But you are there. Yes, I'm bone with the bone. And now I start. This can be a little bit painful. Better I use a little bit the part that is more soft. Okay. And I push. I can go a little bit another spot or middle. Okay. Good. If I want to use a little bit to go deeper, I'm here and I will face left. I can go a little bit more. Push. Lock. Put. Meet. You have the meeting first. Bone with bone. Not pushing the knee. You immediately react when I did it. Incredible. Yeah, the body know before we understand. And then little bit. Now no problem. You cannot go too deep. You always can go too fast. Too fast, like reaction. This, okay, clear? You can try, you can do it differently, understand the principle. Into the femur bone on the anterior part. Lock, open slightly the leg. And then put fixed point. Also imagine a little bit leverage. And then from here. I in 1. I go a little bit up. Yes, this is more on the top. On the top. From the inside, same, a little bit out, again, on the adductor muscle. This is painful, a little bit painful, should be a little bit painful. How much painful? That is feel good pain, not something that the body push you over. You have to communicate today about pressure for learning. More, less, more, yes. We learn it like this. The leg is very important, that is a little bit open. And then need to find the angle that I am a little bit control, like this, sometimes even like this, anything that you find a fix. So you can change it from person to person. There you go. Find a good fixed point. Maybe like this. And from here I can go. So it's not exactly on the manual, it's how you find it. You find the fixed point, lock. Yeah, I would like to do a little bit of spiral here. I can feel it, my intention to move the torque handle a little bit out. And from there, tick, tick, push, go. And go another spot, lock, lock, and go.
Es como primera y segunda línea juntas.
Sí, segunda línea, pero dentro ahora. La misma como hicimos antes, pero dentro. Una más posibilidad con él. Como hicimos en lo isquiotibial. Lock, lock, clear. La position, first position until you find it. Go, okay, I'm okay, I'm okay. Fix one. And then I push. In. And again, I use a lot of this. Very little. Like this, okay. In. You have to explore a little bit. Check, maybe up. Okay, walk. Yes? Last one. We did outside, we did middle, we did inside with the tibia. If I want to work on the tibial anterior, more difficult, but possible. Push it a little bit in. I want to work here. Leg a little bit in and support here. And you bring it now fixed point. And you pull back. One. Lock. Ooh, it's a delicious one. For the knee and for the ankle. Delicious. Stomach meridian. It's one of the best places to work on for everybody. For the vitality as well. It's connect to the interracial members between the tibia and the fibula. Okay, tack, tack, tack on the other side. And I have to do nothing, just to block. So the technique is working with the tension of the receiver. You can wait.
Fácil.
Nothing. So this will not work on someone that is flexible. Not on that way, no need. But when there is tension, immediately it's working. So here, you can lock, and I just move. Move, lock, block, and wait in here. If I want to go deeper, I can go more like we did on the arm string. I lock here, similar what we did. And this time I can use a little bit that movement if I want to go a little bit deep. This. Okay? Take this a little bit deep. Not difficult, huh? The knee more difficult. So when we have the knee, this will be piece of cake. No? Again, I feel the femur with my instep behind it.
What do you call the instep? It's like the inner arch.
The inner arch.
The inner arch.
Yeah, instep in English.
Oh, the word instep.
I don't know this Shokananda is.
Instep? Weird for me. Inner arch.
Then I can take, I want to go under the trochanter for stretching for the psoas. I can go going into the trochanter bone and I make it like a ramp. I make it like a ramp, 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 ramp. Take it up with the fascia. Then I put under. Now, in some cases, we need to be careful with people with knee issue. An extreme case of back pain is a little twist on the lumbar, so we need to be careful a little bit. It's good for the back, but not in extreme cases of a back pain. So observe it. 9 of 10 people, no problem, but the 10 people can be issues sometimes. Okay? So here I can walk, and I know where I'm walking. Como un poco, ¿a dónde está? Aquí es el sacro. Aquí es cerca el sacro. Okay? So yo tengo el piriformis muscular y el glutes. Okay? Walk, walk, just receive. Es posible ir atrás de la rodilla, aquí, ir un poco abierta. Y ahora, como hicimos, ahora es más fácil. En el medio de femur, yo quiero ir afuera. Lock. Y ahora para este afuera, el femur. Y aquí, mira a la izquierda y take el femur. Muy bien para la espalda baja. Lock, go. Punto fijo y este. Así. Lock. O en el medios. Aquí, con el karate dentro. Aquí es el ilíaco.
Cresta ilíaca.
Cresta ilíaca. Y en el medio de cresta ilíaca y el trochanter hay el glúteos mínimos y medios, que está muy fuerte. Y aquí, and then, claro. That's it. Vamos.